Okay, well, we're going to go ahead and get started because we have a busy session for you all, exciting session. I'm Beth Resnick, Assistant Dean for Public Health Practice here at the Bloomberg School of Public Health, and excited to welcome you all to our last, but certainly not least, of our summer virtual series, and excited to have this really great panel today. We're going to be talking about public health equity and social justice conversations, ideas, and actions. And I think you all will not be disappointed in this great line of speakers that we have today. I am going to pass it off to our Assistant Dean of Diversity, Equity, and Inclusion, Joel Bolling, in 1 second. But I also wanted to just highlight that we're going to have students and also faculty as part of this. And then there's a student only after party. It's funny, when the three deans was the first part of our session on this virtual series, and they were like so upset that they couldn't go to the student after party. This is for students only, the after party. And really, hopefully that you all take this as an opportunity to get to know each other, start networking. We have fabulous student leaders here today that will be leading the after party. So I want to turn it to Joel, who I have to compliment or congratulate, a new dad. I think, I forget, a month. Time's so weird now. I don't even know how long it is, and you probably don't either, Joel. But I really appreciate you coming off of your paternity leave to join us today, and it shows what kind of person you are, the commitment you have, not only to your own family, but to our family here at Bloomberg School. So thank you so much, and please introduce yourself and share a little bit about your work as our inaugural Diversity Assistant Dean for Diversity, Equity, and Inclusion, who you arrived, I think, January 2020, just in time for all of the things going on with COVID. So we really appreciate all of your leadership over this trying time, and it's made such a difference having you here. And I want to thank you for all of your work.
Thank you for having me, Beth, and certainly welcome to everyone who's participating today, our wonderful panelists and co-facilitators. Thank you all for spending your time helping to have these conversations and welcome people into our school community. I will just take a few moments before I continue just to provide a quick land acknowledgement. Obviously we recognize that our students, faculty, staff, our broader School of Public Health community are in communities all over the world. But for here in Baltimore, we just want to acknowledge that the land that we are on is traditional homelands, traditional and contemporary homelands of Indigenous people. That our campus resides on unceded lands of the Piscataway and Susquehannock peoples. We recognize the enduring presence of more than 7,000 Indigenous peoples in Baltimore City, including the Piscataway, the Lumbee, and Eastern Band of Cherokee community members. As we gather from places where we are across the country, around the world, we honor and recognize the Indigenous people of our homelands. Together, we acknowledge the history of genocide and ongoing systematic inequalities, while respecting treaties made on this territory as a step towards reconciliation and strengthening relationships and partnerships with Indigenous peoples and their communities. We give thanks to the past, present, and future stewards of this land and respect all nations, all tribal nations' sovereignty and right to self-determination. We aim to hold ourselves and the university accountable to tribal nations. And a special thank you to the members of our Center for American Indian Health, who largely led the way to develop this land acknowledgement and share it with our school community. So again, I'm Joel Bolling. I'm so excited to be here today. I serve as Assistant Dean for Inclusion, Diversity, Anti-Racism, and Equity. I'll start off by just sharing a little bit more about what we refer to as IDARE is within the School of Public Health, but I won't spend too much time talking about IDARE as a kind of a concept and what we are doing, because I really think it's important to hear from our wonderful panelists and importantly, hear what questions that you all have and insights that you all have that you'd like to find out more about. So I'm going to quickly, just very briefly share my screen to keep me on track. And then I'll turn it back over to Beth, who can continue on with our program. So let me share my screen just briefly. So from again, this is Inclusion, Diversity, Anti-Racism, and Equity at the Bloomberg School of Public Health. We call it IDARE. I like to think about our work in the context of this charge. Somewhere on one of our websites, I don't exactly remember where, this statement really resonates with me in terms of how we should be thinking about our work within the School of Public Health, and our engagement within the field of public health. That ours is a world of constant change. Certainly in this last year, we recognize that tremendously. Last 2 years, we recognize that tremendously, that there are social, economic, political, environmental, and other forces relentlessly challenging the human experience and human health. And so when we think about IDARE and how we engage in the field of public health, we're really actively looking at ways to address all of the ways in which we acknowledge the wholeness of human health, and striving for that as a community. So we talk about IDARE. I won't go through all of this, but we really think about it in terms of inclusion, ways in which we can create environments that make people feel and be nurtured. That diversity, we recognize the full range of different identities and backgrounds that people come from, and that we not only welcome, but understand the value of that diversity within our work and within our world. That anti-racism is something that has been talked about in certain circles for a long time, but has really come to the forefront of a lot of our work, really thinking about how we can actively challenge race-based bias and hate, and intentionally work to expand inclusion, equity, diversity, and justice for all people, inclusive of identities, while challenging systems of supremacy and systems that prioritize whiteness. And then lastly, equity, this idea of fair treatment and access to resources and opportunities for all people. For me, these four are really combined with this idea of belonging. So there's some great work that happens out of the University of California, Berkeley. There's an Othering and Belonging Institute, and they've really led the way in some of these conversations about how we create communities that really are radically inclusive, that bridge and don't break, that allow for all of us to work together and be together in a way that supports health, wellness, and wholeness. So at the School of Public Health, some of the things that the IDARE office does to help create that feeling of belonging, along with all of the work that happens, not just from the IDARE office, but across the school. Here are just some of examples of the things that are going on. So our diversity summer internship program that some of you on this program today may have even participated in, helping create some pipelines towards the field of public health. Our wonderful source office, which is our community engagement and service learning office, for the schools of public health, nursing, and medicine, all the way through a variety of different offices and areas. I won't go through all of these, but just to say that there are a variety of ways in which you can be engaged and resources to support IDARE work within the field of public health and at the School of Public Health. I would be remiss without mentioning at least some of our wonderful academic centers and institutes and programs. So I already mentioned the Center for American Indian Health. We have centers like the Center for Global Health, the Urban Health Institute, certificate programs in all different areas that intersect with IDARE and public health, including our LGBTQ certificate in public health, child and maternal health, climate and health, etc. So all of this really started back in 2018, where we had our school's Power of Public Health strategic plan, looking at, under the people section, ways in which we could cultivate inclusivity within our School of Public Health and recruit and retain a diverse community. So my position was created, and I started back in 2020. Since then, we've come a long way and done a lot of work, though there's so much more to happen within the School of Public Health. Most recently, and certainly critically, is that in March of 2021, we launched our IDARE action plan, which really outlined what we would be doing, what action steps we would be taking as a school community to move us forward in terms of IDARE. All of this grounded in these 4 areas that we integrate IDARE as a critical framework of thread throughout all of what we do, that we are ensuring adequate resources for this work, that we are striving to be a role model for IDARE amongst schools of public health and in the field of public health, and of course that we are committing collectively to do this work and not relying on traditionally marginalized communities and Black, Indigenous, and people of color communities. So I'll skip ahead of this, but again, this is kind of where we have gone within the action plan. You can find out more about the action plan online. And so just lastly, I would challenge us today and you all on this call to think about how we can help move forward. So I encourage you all to participate in departmental and JHU IDARE related groups. So there are different committees and opportunities to be engaged. Certainly participate in student organizations and student-facing groups. They do tremendous work to support IDARE within the school and connecting us back to the community. I'll skip the middle one for just a second. I would challenge you all to hold yourselves, so ourselves and our school accountable to this work. It's so easy to get caught up in some of our day-to-day other obligations, and sometimes IDARE may slip to the back of our minds, but we want to keep this front and center. That we follow the lead of our communities that we are striving to serve and be working with and be a part of. And then lastly, that we continue to think about how we can be a link in the chain. For me, this is one of the things that has driven me to the work that I do, that we should think about the ways in which others who have come before us have helped pave the way to make a better world for us. And create pathways for us. And so it is our responsibility to go ahead and create those pathways for the next generation to come. And so these are just some of the ways that you can be engaged in this work. So with that said, I'm going to stop sharing. Hopefully I didn't ramble on too much. Again, happy to be here with you today and continue this conversation. So I'll pass it back to Beth.
Great, thank you, Joel. And like I said, you really did hit the ground running coming in here as the inaugural dean, and then bam, everything hit all at once. So really do appreciate all of the work that you have done for our whole community. And again, having to sort of set the stage for all of this in the midst of a pandemic when you were brand new to the school is a lot. So thank you. And we really do appreciate all of your great efforts and leadership. So next, I'm excited that we have student leaders here today to introduce our speakers, and I'm going to pass it to Hannah Crockett. Hannah, can you please introduce yourself and then introduce our first speaker?
Yes, sure. So hi, everyone. My name is Hannah Crockett. I'm a full-time MPH student here at Hopkins studying humanitarian health, and I'm interested in program management and evaluation and working with refugees and IDPs in international humanitarian contexts. And I'm also a member of a recently formed student interest group focused on migration and health issues, which we are very excited to be here, many of us, today to talk with Monica Guerrero Vazquez, who I will be introducing. So it is my privilege to introduce her. Monica is the executive director of Centro Sol, which is the Center for Health and Opportunity for Latinos, whose mission is to promote equity in health and opportunity for Baltimore's Latino community. She immigrated to the US from Ecuador several years ago and is passionate about improving quality of life for immigrant origin communities. And she received her MPH here at Hopkins in 2018, focusing on child and adolescent health, and is currently pursuing her doctorate. So she'll be speaking to us today about her efforts to promote health equity and social justice for Baltimore's Latino community through Centro Sol. So welcome, Monica.
Hello, Hannah. How are you? Hello, everyone. Thank you so much for the opportunity to talk to all of you. I have to start apologizing because my internet broke, and I'm trying to get signal in my porch, and I'm hoping it doesn't rain. So I had slides prepared for you all, but if it's okay, I will share the link to our website with our the organizers, and I can just briefly tell you a little bit the story about Centro Sol and how we started. In 2013, a group of leaders, clinicians, social workers, physicians, and leaders at Hopkins came together in response of the increasing number of Spanish-speaking patients we were seeing, particularly in the Southeast area, Bayview primarily, but also in the main hospital. And they joined to discuss what were the needs, because we didn't have enough interpreters, we didn't have enough bilingual clinicians to serve these patients. And they established what back then was the OLA organizations, the OLA organization, the Hopkins Opportunities for Latino Awareness, that derived in 2013 to receive private funding matched by Johns Hopkins from the Strauss Foundation in Baltimore. So a very local and localized effort to identify needs and really conduct some sort of needs assessment to see who we are serving and how we can better serve. From that, we established Centro Sol, which is Center for Health and Opportunities for Latinos. Our mission is to promote equity in health and opportunities, so we don't focus only on clinical care or the cure or prevention of diseases. We are trying to provide a more public health approach, a more expanded vision to improve the quality of life of our Latino neighbors. So to achieve our mission with a vision of improving the lives of all in Baltimore City, we work in 5 core areas that you can identify on the website. So I'm not gonna repeat all of them, but I'm just gonna briefly mention that we work in the clinical innovation effort, not so much if we don't have a center, Centro Sol, we have like a group that comes together to really identify solutions for some of the main public health issues. So clinical innovation is a way to respond to the lack of healthcare access. As you may be familiar, the Affordable Care Act doesn't allow or prevent undocumented immigrants from receiving health insurance from the health exchange. And some immigrants, even though they have documentation, they may not be permanent residents, so they may not qualify for health insurance either. So the clinical innovations come to respond to the healthcare needs of those individuals. And we partner primarily with the Esperanza Center, but also we work with the Johns Hopkins community physicians and other providers and researchers. Another area that is very important for us is the youth program. So it started as a pilot in 2014 when we started operations to respond about to diversify with the vision of diversifying the workforce, because as you probably saw from the census 2020, the Latino population increased in the past since 2010 more than 75%, and that came after an increase of over 134% from the census previous to 2010. So the Latino population is growing really fast, but we are not, our infrastructure is not prepared at the same pace to respond to the needs to the community. I think there's something in the chat. If there is anything, feel free to interrupt me, and I can pause or I can do something else. go into the youth programs. We offer mentoring and tutoring throughout the school year. As I said, in 2014, the youth in the summer program used to share their stories about how they are told in schools that they should not pursue higher education, that they should not apply to college because they don't have immigration status. So what are they going to do here with a college degree? So all the youth, and I'm very proud to say this, but all the youth from that cohort in 2014 not only finished college, 4-year college, but they are also pursuing graduate degrees. So some are getting engineering degrees after college. Some are getting pre-medicine and education degrees. So our youth programming aims to encourage youth, but also give opportunities to expose them to different careers. So I would call to all of you, if you are interested in becoming mentors or in talking about your career path or sharing some experiences that you learn along the way in your own career development, please reach out, because we will definitely benefit a lot providing opportunities to the youth. And I'm going to wrap up quickly, just mentioning our current COVID response efforts that respond to the different areas that we work on. So in April 2020, when the COVID-19 pandemic started officially, we were contacted by the families that we were serving at the children's medical practice at Bayview, and some that were served outside of Johns Hopkins, because they couldn't leave their house and they didn't have food. And some of them were sick with COVID-19. So it was very concerning for us. The messaging that we were giving out, first of all, the messaging primarily in English, but the messaging that we were trying to get to our communities was very difficult for them to overcome their barriers, because we were telling them, you cannot leave your house, but if you don't have food, then you have to leave your house and go to crowded spaces, schools or community centers where you can get a meal for your family. So you have to come every day, once or twice a day, to get a meal for your family. So, it was really a public health concern, because we were bringing them together when some of them were already reporting that they were sick, or they were feeling, they were having symptoms of COVID-19. So we started in response providing not meals, but we started providing groceries that they could use to feed their entire family for a week. And initially it was only 25 families. And in less than 3 weeks, we reached almost 400 families. It was a grassroots movement, and I just wanted to highlight the importance of actions organized by the community that brought together multiple organizations and elected officials together to respond to the food insecurity and food access in our community. And something I wanted to share about that project is that it was culturally appropriate. And we oftentimes forget about the importance of cultural appropriateness in our work, because we were trying to offer a solution that was not one size fits all. Like, it was not meals for everybody, because the meals were not really, I don't know, for the lack of a better word, were not really appealing for them. It was very difficult to go get one meal every day. But it's also the food that they were receiving sometimes is not appropriate. They don't know how to prepare them. They don't know how to make them. And in the food access area, probably many of you have more experience than I have on this, is when people are hungry, they can eat anything you give them. And that is not true. Like, we were giving people cans of food that like they didn't know how to make, they didn't know how to eat. So we saw cans of food, unopened cans that were thrown to the garbage because they didn't know how to, or they didn't know how to cook them or eat them. So something very important in the design of the project is the cultural competency, and in particular for immigrant communities, it's language appropriateness too. So I like to start talking more about the cultural appropriateness and language appropriateness as opposed to cultural competency. Cultural appropriateness and language appropriateness puts the community and the individual in the center. So they are the ones that inform the policies, the solutions, the programs, the activities, the initiatives that we may be able to provide or facilitate for them.
And I'm sorry,
yes.
I hate to interrupt you because you're giving us such great information. I just realized Keilah has a time limit, so she's going to have to run off. So are you okay? Can we ask you questions and do follow-up? Because I know students are going to have great questions about all the great
Yes,
stuff that you just shared with us.
Absolutely.
I want to make sure we can hear from Keilah because she has to run off to a wedding, which is so nice to hear that people are actually getting married. So I really apologize, Monica, because this is great stuff. But and I know, Jaimie, you're going to quickly introduce Keilah, and then she's going to give us a little taste of her wisdom. And Monica, then we'll go back to you.
Thank you.
Thanks so much. Apologies for the interruption. Hi, everybody. My name's Jaimie Shaff. I'm a third-year DRPH student in the Health Equity and Social Justice track, and I've been with the New York City Department of Health as the Chief Data Scientist for the COVID response. So it's really my honor to introduce you to our next speaker, Keilah Jacques. Keilah is a social justice health leader and anti-oppression educator who works with communities, hospital systems, and institutions of education to advance critical consciousness development around racism and health. Keilah is an award-winning course designer who draws anti-oppressive frameworks, transformative education, liberation theology, structural competence, social innovation, moral resilience, collective impact, participatory appraisal, and human-centered design. Really looking forward to hearing from you, Keilah, and thank you for joining us.
Thank you for having me. And I also will start with apologies, first to Monica for cutting your time, but also to the collective for not being able to stay for the duration of the conversation. As Beth mentioned, I'm celebrating love. And so I hope you can accept that that is the reason that I am running away, which is a foundation for the work that I do. So in my role in the past 5 years there at Hopkins, I worked at Source, the Community Engagement and Service Learning Center, to provide personal and professional development, both to students and to faculty, around incorporating anti-oppressive tools that focused on anti-racism into their coursework so that we could do the partnership, much like Monica mentioned, in collaboration with community-based organizations who are boots on the ground and subject matter experts in what communities need. So my work in this space as a public health social worker really has been to bring frameworks of social justice into public health education with the understanding that we can be committed to the work of health equity and not necessarily have the tools and the infrastructure inside of our institutions, as well as inside of our practice, to know how to disrupt the systems that lead to inequities in health. So the work that I do now, though I'm no longer at Source, is still connected to informing and educating folks around anti-oppression and anti-racism. I'm actually a part of a collaborative that will lead a faculty development effort called Cultivating Anti-Oppressive Learning Communities, where the focus will be on teaching faculty anti-oppressive pedagogy and helping them incorporate anti-racism and social justice frameworks into their courses. Outside of the work that I'm doing to train faculty, I'm also still a part of the work that it's so important to training students to be the public health leaders that focus on social justice. So I have the great pleasure to still be adjunct in the health behavior and society department, where I will be teaching a course in 4th term called Social Justice Policy, Practice, and Research, where we'll focus on bringing social justice frameworks to students' work as they're learning. And then it is an experiential learning course, so much in the tradition of SCORES, focusing on partnering with community-based organizations to move the learning around those frameworks into practice so that we're building into the learning process, actual practice. So I see that April has dropped the link to the course in the chat. Thank you so much. And I will stop there so that there can be questions if there are questions, and then I will run off to this wedding.
Go ahead, Jaimie, with your question.
So given everything with COVID-19 in the last year and a half and how disruptive it's been to all of us in the world, and particularly the communities hardest hit, what are some of the things that we can do as a community and as a public health community to really engage one another throughout our coursework and throughout our work within communities?
Yeah, I appreciate this question, Jaimie, and I will highlight the work that Monica is doing because I think it's a perfect embodiment and example of how we can intentionally center at the margins. Joel mentioned in his introduction to IDARE work the importance of listening to our community voices and partnering with community. And so in the ways that communities are finding tools for their own survival and need our partnership because they are the experts in their lived experience, right? They have built within themselves the capacity to overcome odds. So they know what they need, and what they need from us is partnership. Though we might have the tools and the expertise of public health frameworks and training, we do not have the lived experience that they have, right? And so by prioritizing listening to and centering their desires, their needs, and their hopes for outcome, we move our expertise into a space of partnership where we can hand in hand move the needle on public health issues by hand in hand partnering with those who are the experts on public health issues in their everyday lives.
Thank you so much. We have 1 more minute for questions if anybody has one in the chat.
And also, Keilah, while we're waiting, I want to thank you. You always approach these like very sensitive and tough topics in such a clairvoyant way that like makes everyone go, oh yeah. So I really appreciate it. I'm sorry we're only getting a little taste of you today, but appreciate that you're going to still be involved with our school in our 4th term course. Is there anything else you wanted to share about other work you're going to be doing or other things while in your last minute before you have to run off?
Yeah, I will definitely share that I'm excited to be a part of the research team with the Black Brain Trust, which is really focusing on building standards within organizations of evaluation around these issues, these IDARE issues, so that we're not just saying we need to do a better job, but we're able to show the impact at a structural level, at an institutional level, and at an interpersonal level of what it means to incorporate IDARE values and strategies in a way that brings change, not just to institutions so that we can be better stewards of the personnel inside of the walls of institutions, but in communities. How do we hold institutions accountable for being instruments of change in communities where there is inequity that's systemic, that's the result of policy, practice, and procedure? How are we as organizations using our privilege, our resources, our funds, and our intentional missions to change those things? So excited to be inside of institutions of education, but also be driving change that set the standard across multiple fields, multiple institutions, and multiple practices.
That's great. As I was saying, when I announced you, when I heard you were leaving, I was like, this makes me sad for Hopkins, but happy for the world that we're going to share your wisdom more broadly. And I'm hoping selfishly that we can still have you here some too. So really appreciate it. And how fitting that you're going off and celebrating love. It gives us all some hope, I think, and joy about the next coming year, and sends us off with a positive spin on such a challenging year. So thank you for making the time for us, Keilah. I really appreciate it.
Thanks for having me. Take good care, everyone.
All right, tonight's been a little bit juggling with our agenda because Allison Barlow, there was with the time change, she's out out west, so there was a mix up with the time change, so she's not going to be able to join us. So actually, I think Monica, again, I apologize, we had to cut you off, and you were sharing some of the exact details that Keilah was talking about, I think, in terms of the community needs and the cultural competency. So I don't know if you wanted to add any additional things to what you were in the middle of sharing, but it was very powerful, and really to put it in real world terms of what these people are suffering and how we had importance for your organization to help them. Thank you for sharing that with us.
Thank you. No, I appreciate it. So I already have internet connection. So at least, yeah, I don't know if you can see me, but I'm on with my phone too. It was really funny because I was waiting for internet and all that. But anyway, can you all hear me and see me? Okay, thank you so much for your patience. And again, I apologize. So I am with the phone. At this point, I'm not going to share the slides. Can you all hear me?
Yeah, we can hear you.
Okay. 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 So yeah, I was just going to share one of the responses to one of major issue post-COVID. We're still in COVID, but what has been happening with the stay-home policies, with so many people impacted by COVID-19. As you know, it affected disproportionately to communities of color. And in Baltimore City, there were high rates of Latinos infected and dying by COVID-19. So that left a mark for all the families. It was trauma that we don't know how it's going to be resolved. As I said, healthcare resources are very, very limited, are scarce in the Latino community in Baltimore City. So in the past couple of years, we were trying to address depression and mental health and create awareness and end stigma around mental health in the Latino community. But now with COVID, we are trying to work more diligently with the communities and our stakeholder network to address the impact of COVID-19, and particularly trying to address depression, which was existing pre-pandemic and now is only worse. There are anecdotally more suicidal ideation, and we are hearing, or I've been hearing of more young adults, young people, teenagers dying by suicide. So our campaign, we developed a campaign last year, and it was launched this past spring in May during the Mental Health Awareness Month, National Mental Health Awareness Month. It's called Fortalece Baltimore. It's entirely in Spanish, and it was reviewed by community members of our stakeholder network, and also we have community members. So we didn't want to have actors, sharing their made up stories, but it was community members sharing their own personal stories with depression. Either they had it or a family member had it, and how they overcame that experience. I can put the link in the chat too, and hopefully you all will be able to see it. We are in the midst of launching more and adding more steps to it. And currently, the campaign is focused on adults, because even though there are limited resources for youth, there are still more resources for youth than there are for adults. Like youth have the school infrastructure, the social workers, or some type of connection. But for adults, their parents, there is really nothing. So I'm gonna put it in the chat. It's Fortalece Baltimore. It's definitely a unique solution here in Maryland, as I'm aware of, and we hope to launch and talk more about that. So I just want to share that last part that is kind of a continuation of an existing project, but also a response to the impact of COVID-19. And I think that's pretty much it. I can talk more. I can talk for hours about the work we do at Centro Sol. Centro Sol has become an extension, really, of my immigrant life. I'm originally from Ecuador. My family and I migrated when I was a little girl, and it's been more than
25 years out of Ecuador, but that definitely shapes your life. And I'm really grateful to have the opportunity to serve immigrants, and particularly Latino immigrants here, because I think those speak a lot to my own experience, and I can translate my own lived experience and my professional experience to work with this community. So thank you very much for this opportunity.
Thank you, Monica. You're the work that you all do is so inspiring and just amazing to hear the differences that you're making, and how you seem to hone in on like a need and find it and then work to make it better, which is really very impressive. So I want to thank you for sharing that. And I want to turn back to Hannah, who I think has a question for you, and encourage other students, if you have other questions, to please put them in the chat.
Yes, hi Monica. So as I mentioned before, and as you are already aware, I'm part of a migration health interest group. And a few of us were chatting about some things that, like some questions we have for you, and we'll there's so many, but we kind of honed in on one. And it's kind of in light of the public's heightened awareness of social justice issues and health disparities after George Floyd's murder and kind of this pandemic that is still ongoing. And you already touched on this briefly, some of the efforts that Centro Sol has, or initiatives that Centro Sol has implemented in the community in Baltimore, but can you speak a bit more broadly to how you all are channeling this energy towards improving health outcomes and quality of life for your clients, and potentially on a bigger scale or a longer term scale?
Thank you for that question, Hannah. I think the short answer to that is I hope I'm not using the wrong terms, but and Joel maybe will correct me if I'm like going I'm not being mindful, but something that we are trying to do is or in the work that I'm trying to do, I'm trying to be more mindful of how are we including the voices of the community we're trying to serve. As I said earlier, there is no one size fits all, or this solution worked in other settings for the same population, because even the scenario may be different, the infrastructure may be different. So I think the short answer is including them in the solutions that you're trying to design. I think a longer answer is leveraging the voices of the communities or the individuals and the personal experiences at higher up levels. So it doesn't stay. And by higher up, I mean like policymakers, for example, promoting policy change. And that may sound like a supernatural step or a supernatural process, but it's not organic. It doesn't happen overnight. And for the big movements to result in social change and policy change, it may be like something really, really big, or something that has been working or that has been happening for a long time. So in that regard, I think empowering individuals, and empowering is not my favorite word in what I'm trying to say, but really, giving people tools about how they can organize themselves, how they can speak up. And I'm just gonna steal an example that I heard some time ago. Now it's when we say that there's no representation at the table, someone may say, but we invited those people to come to the table. It's up to them. We don't know why they don't come to the table. And so when we come to that reasoning, we should think, well, maybe they don't come to the table because they have never, ever been invited to be at the table. And they don't know how to be at the table. They don't know how to talk about the issues that are being brought up. So yeah, so it's like trying to provide those tools to channel and like help people to promote the policy change that they may need in the communities. For us, it has been a work over time to be part of the health system. We have patient and family advisory board that it's really a reference, a model that is a reference for Johns Hopkins. How to talk to them, how to engage them in the conversations, how to present the solutions that we're trying to come up with, so they can validate and give us feedback is important. But it like that particular group has been in place since 2011, and it's been since then up until now when the members feel confident enough to say that system doesn't work, or that program doesn't work, or even the opposite too, like that program is fantastic, you should keep it, or something like that. I'm not sure if I'm answering your question, Hannah, but it's basically just listening and being respectful of what people have to bring to the table.
Thank you, that was perfect.
Thank you, Monica. You always speak so beautifully and so authentically. And you raise a really good point. Like, we invite people to the table, but maybe they've never been to the table before. You know, that's a simple concept, but so powerful, and something that I think when people are, you know, putting their little guidebooks together or tips for how to work with the community, nobody talks about that. So really great points and such powerful examples. So I'm sorry that we weren't able to have Allison Barlow join us, but I do want to ask Stephanie Busch, our student who was going to be introducing her, to first of all introduce yourself, Stephanie, as you have a lot to offer here as well. And then maybe you could just give us a little short blurb about the Center for American Indian Health, and we'll put something in the chat for students who might want to find out more, because they do a lot of great work. So thank you for being here with us, Stephanie, and go ahead.
Yeah, thank you, Beth. So my name is Stephanie Busch. I'm just started my second year as a part-time MPH student. I am currently the injury prevention manager at the Vermont Department of Health, so oversee a team working to address the injury burden in Vermont. We focus predominantly on suicide prevention, opiate overdose prevention, and then also highway safety related topics is kind of what we're currently funded to do right now. And as I said, I'm part-time. I'm also a Bloomberg American Fellow in the area of addiction and overdose, and I love connecting with everybody. So if you want to know what it's like to work at a small centralized state health department, more than willing to chat. And I know one of the things, it was really interesting hearing everyone speak specifically around, you know, health equity and COVID. So I've been involved in the Health Operations Center, and so our state's response to COVID. And I know that this has been a big challenge for us, and a lot of lessons learned, both good lessons and bad lessons. And so, as Beth said, Allison Barlow is the director for the Center for American Indian Health, which is a partnership which partners with Native American communities to improve health and well-being. And thank you, Joel, for putting the link for that. And so she's been the director since 2016, and among many other accomplishments, also played a key role in the development of the public health certificate for American Indian Health. I know there's a lot of information. I know that they have done a lot of work specifically in the COVID response, and I've seen a couple different presentations. I would encourage you to check out their webpage and get involved if you're interested.
Great, thank you. And I think something that's signature about, similar to Monica, is that the Center for American Indian Health is really trying to do it in a culturally competent way and engaging directly with the tribes and their partnership as a listening and trying to support, rather than going in with as a lead or telling people what to do. So I'm sorry that we're not going to get to see Allison, but they do fantastic work, and I do encourage people to check out their site and get more involved and finding out what they're doing. And so I'm going to turn it back to Joel. And again, I encourage any students to put any questions in the chat. And also encourage our student leaders who are on this panel to chime in if you have some other thoughts or if you have additional questions for Monica or Joel as well.
Great. Thanks, Beth. So I'm going to ask just anyone who would like to chime in on the call today, the panel. This question that I think is really key to the work of not only the field of public health, but really when we're thinking about being uniquely in a school of public health, that I think it's important for us to recognize that there's this educational aspect to our existence within the field of public health and for all of us, our time at the School of Public Health, to not just address public health issues, but really think about how we are innovating, changing, and leading the way. So I just asking the group, we've talked a little bit about certainly the amazing work that Monica and Keilah and others are doing in this field, but can you talk to us a little bit about how you help to invite others who may be less knowledgeable about engaging with communities, working with communities, the issues that communities are facing? How do you educate others and engage others in this act of bridging, helping them understand, connect, relate to the challenges, issues, and lived experiences of the communities that we are called to serve? So anyone can certainly jump in, and again, you don't have to have the full answer. I don't think there is a full answer, but any perspectives that you would like to share.
So I can speak a little bit to how Vermont kind of responded to the COVID-19 pandemic. There are several communities, New American and refugee resettlement sites in Vermont. And some of the things that we realized pretty quickly that we have a robust communications department. We're putting out a lot of information on our websites, on social media and whatnot. Understanding we have, I believe, 9 key languages that we have to translate any essential documents into. And one of the things that we learned maybe not very quickly after we had a bunch of outbreaks, that all of the messaging was not on any platforms where people among the new American populations used. So one of the big things within our communities was using WhatsApp. And so we kind of pivoted to really work within the communities, and there's a couple different task force that have been kind of grown out of that to really engage community leaders and making sure that messaging is getting out there. And also I know Monica spoke to food insecurity, specifically like during quarantine and isolation. And we developed actually something very similar with our multi-generational households, where we're telling people that they have to stay inside and they still need to eat. So it was pretty exciting.
Yeah, thank you, Stephanie. So I'm thinking that equity and social justice seems more like an act of revolution a little bit. So it's not just one thing, but you have to like convolute and check everything. And like when people see you coming, it's like, ooh, there it is. She's gonna ask us again if everything is translated to Spanish. Ooh, again, she's gonna tell us like, is there an interpreter in the room? Are you gonna offer the panel in Spanish? Do you have people who speak Spanish in your group? So sometimes I feel that the contribution I make is ask the same question over and over again until someone listens, and then they end up translating the materials, or they end up having someone. So something I have seen in the city is very similar to what Stephanie just described. and something very particular about Baltimore City is that it's a city that there are a lot of disparities. They're very, very localized, and like they are, I think you all are very familiar with Baltimore at this point, that you know what I'm talking about. So you know exactly if you go from one street to another, like the difference and where you are. But on top of that, or below that, I would say the non-English speaking communities are really invisible at times, many times. I do hope, my hope was that the census will bring us some attention to be more aware about how that we need to be more language appropriate. So I think, sorry, I'm talking, I'm saying a lot of things, but what I'm trying to say is like really to make the groups, organizations, and systems aware of how to better serve the community, the marginalized communities, is repeating, being the annoying voice that they don't want to hear, right? Like, do you have this in Spanish? Like, how many Spanish speakers do you have? How many Latinos? How many immigrants? How many refugees? How many people of color in general? How many African Americans? Until there is a moment that before you ask the question, they say, oh, by the way, we have to translate this to Spanish. And I'm happy to say that in some of the groups I'm part of, I don't have to ask the question anymore. You know, it's brought up more organically, but still not happening at the pace that we should be responding. Yeah.
Thank you, Monica. I just want to clarify, I don't think that you should call yourself annoying. I think it's more the importance of what you're doing, and that you need to be there and they're the voice for the people that need the help, so or need the partnerships. So I'm going to correct you on that, because it's not annoying. It's what your mission, right? And that's what we all should be doing as public health professionals. So thank you guys, and thank you, Joel, again for being here with us and our students. Our students are going to lead us in the student after party. That April just put the link in. Hannah, I had a question for you, but now I'm going to ask you, and maybe you can answer it in the after party. I know you mentioned that you are on this task force, so I think it would be great if you would share with the students about what this task force is, how it started, and specifically around how students can get involved in some of this great work. And I guess on last note to Monica and Joel, if there's anything in particular that you would encourage the students if they want to find out more or get involved in some of your specific efforts.
I'll share the link to the IDEA office in the chat. Actually, I will not share that because our school is about to relaunch our website, I think tomorrow.
We'll put it in the follow-up. We'll put it in the follow-up information that we send out to all the registrants. Yeah. Thank you.
But I would just challenge or share, and certainly Monica, I really appreciate all the work that you are doing and the comments that you have made today. But I just encourage you all to think about, as you continue your professional and educational journey within the field of public health, think about doing exactly what Monica is doing and so many others, thinking about the ways in which we can disrupt, challenge, and change systems that we recognize as inequitable, that this is not an intellectual exercise, that we're really talking about day-to-day challenges that people are facing and the lives of entire communities. So thinking about the ways in which you can respond to all of these crises at all different levels. And so that's a big ask. So I will pair that with, while you're thinking about that, understand these systems did not just create themselves today, nor will they go away tomorrow. So think about how you are incorporating self-care and thinking about the longevity of yourself in this work, because it can be draining, it can be exhausting. Certainly there are wins that we should be celebrating, but there's always so much more to do. So thinking about how you can maintain yourself in this work is so critically important. So I challenge you all to think about that as well. So I'll pass it to Monica for other thoughts?
Yeah, thank you, Joel. I love being in, seeing you. We definitely have to connect for collaborations offline, but just want to add, don't be afraid. Your contributions are important, and your voice can be listened. So don't be afraid, especially if you're from minority, if you're an immigrant, refugee, if you're a person of color. The imposter syndrome is strong, and it's very hard to overcome it. I went through a period of a lot of depression because of imposter syndrome. So self-care is important, and don't be afraid to speak up. And I really look forward to the task force that Hannah is co-leading, because we would like to collaborate with them on some of the programming and activities that we have at Central Salt. So maybe you can engage with her group, and we can do something together. Thank you.
Terrific. Thank you guys both for going through lack of internet, new baby, and really hanging with us here tonight. I really appreciate it. And so I'm going to invite everyone from the students to join us in the after party. If you want to get there by about 5:35, give yourself a chance to run to the restroom or whatever else you need to do. And again, I want to thank our panelists, and thank you, Polani and April, for running this. And students, I'm going to see you in the after party for 1 second, and then I'm going to jump off. So thanks again, everybody. Have a wonderful night, and take care. And again, thank you for such an inspiring session.